Our fourth session is on tracking the novel coronavirus in India, testing modalities, where we are and what more needs to be done. Testing is crucial for containing the spread of COVID-19. In fact, this is even more critical than contact tracing, according to some experts. Many nations across the world, like South Korea, adopted very aggressive testing and contact tracing. The rate of transmission is far less in these countries than others who did not follow it aggressively enough. In India, too, only symptomatic people or those with complications were tested initially. This may be the one reason for the rapid spread of the disease. Because if you're not testing enough people, you cannot contact trace. So a person with mild symptoms may spread the disease to many. Moreover, because of the high cost of the tests, many people also apparently hid their symptoms and did not come forward for testing. People have had many questions regarding these testing modalities and availability of tests across various regions in India. In this particular session, we have our experts who will shed light on where we are at present and what more needs to be done. So let me introduce the two panelists for this session. We have Dr. Arjun Dang. Dr. Arjun Dang is the CEO of the highly renowned diagnostic center, Dr. Dang's Lab. He has completed his MBBS and MD in pathology, a clinical fellowship in liver pathology, with a special interest in the field of oncology. Dr. Dang has done extensive work in the field of triple-negative breast carcinomas. In the current COVID-19 pandemic, Dr. Dang has played a crucial role in defining protocols related to infection control, training of staff operations, and analytical procedures. Recently, Dr. Dang's lab has also partnered with Hyderabad-based Bharat Biotech for conducting human trials of India's indigenous COVID-19 vaccine candidate, Covaxin. Hi, Arjun. Welcome to the Health Summit.
Thank you, Pooja. Thank you for that introduction. I've been looking forward to this session.
Also, we have with us Mr. Rakesh Maurya. Mr. Maurya is the CTO and Lead Scientist at Redcliffe Lifesciences. He's an expert in next-generation sequencing, transcriptome, metagenomics, and more. Under his leadership, this diagnostics and medicine company collaborated with government institutes in Lucknow and Odisha to help them create COVID-19 lab facilities. Redcliffe Lifesciences is also in the process of developing a molecule-based drug for the condition. Additionally, they are trying to analyze differences in genetic code of viruses from different patients. This will help in mapping real-time COVID-19 spread in India. Without spending more time, I would head straight to the questions. So Arjun, my first question goes out to you. I would like to ask you a very simple, very important, yet a very simple question. People with what symptoms should go in for a COVID-19 test?
Okay. So Pooja, that's a very basic and a relevant question for the audience to understand. What are the indications of getting a COVID-19 test done? So I will primarily put this in two buckets. One would be the symptomatic people, like you said. So the main symptoms of COVID-19 that I'm sure everyone already knows is a fever, a sore throat, a cough, or breathlessness. But of late, there have also been multiple other symptoms, such as body ache, loss of taste and smell, even gut-related symptoms that have come up. And that is why it is very important for anyone not to rush in to get a COVID-19 test, but to consult their physician and actually take their advice if a COVID-19 test is required. Apart from this, anyone who doesn't have symptoms but has had direct contact and is at higher risk, for example, anyone with comorbidities or diabetes or hypertension, or is a cancer patient, or is very elderly and has had direct contact with someone who's had symptoms or who's been diagnosed as COVID-19 in the same household, they also need to get a test done. Apart from that, the government also has laid down certain norms for travelers who come from abroad, from countries that have a higher prevalence of COVID-19 infections. They would also need a test. So it's very important to take your physician's guidance before actually going for a COVID-19 test.
So Arjun, how long does it take to get the results of these tests?
So if you refer to the COVID-19 RT PCR test, that is the gold standard for diagnosis, and also by ICMR, that has been laid down as the gold standard. This takes anywhere around 24 hours for the results to come out. And actually, we must applaud the Indian labs, because I was just reading that even in Western countries like the USA and New York, it takes about more than a week. But most of the labs in India, especially the private labs, give out the results within 24 hours or sometimes within 36 to 48 hours. So that is highly commendable.
That is actually commendable. So with that, I'll like to go to Mr. Maurya with my next question. So, Mr. Maurya, what is the average cost of a COVID-19 test in India, and also what is the price range of a testing kit in our country?
So the average test, if you see, I mean, it ranges from rupees 2,200 to anywhere around 3,300. The government earlier already capped it at 4,500, but now because when the pandemic was at an earlier stage, the costs were high, but now due to large production, the costs have come dramatically down. And if you see that there are multiple, kits available which are available at cheaper price. But on an average, I can see I'm in Noida, I can see in Delhi NCR, the average testing price is somewhere around 2,500, 2,200.
That is great to know. Also,
Yeah.
Mr. Maurya, recently a testing kit named Corusol has been launched in India. It is
Yes.
approved by CGI and ICMR, and
Yeah.
the base price is rupees 399. Is there any report about its efficacy till now?
See, it's a really this is an indigenous kit. Before that, also my lab came with an indigenous kit. The basic difference is that for any for any detection of a viral RNA, you need a kit which is highly sensitive, and generally they use probe-based chemistries. Probes are nothing but they are highly sensitive technology by which, like Tachman and hydrolysis probes, by which you can detect the virus at a very low copy numbers, and even in degraded samples you can check or test this. The IIT kit which came out is the first probe free kit which has been approved by DGCI and ICMR, and I'm sure since it is developed in IIT, I have gone through that paper and the details which they have shown in the website and in their articles. They say that they have taken almost all the sequences available for this coronavirus, and they have identified highly conserved region to design their assay. When you design an assay or test on a virus in a highly conserved region, even a fluorescent method like IIT's method should work. And I am sure ICMR has its own protocol to check the efficacy of these kits, and I'm sure it should work. At least it should work better than antibody or antigen kits which are there in the market. So because antigen and antibody kits, they have an efficacy of somewhere around 85 to 90%. And there are kits which are coming up now which show that they have accuracy of 98, 99%. But across the world, even Roche or Abbott kind of companies, their kits are not working to that level, to the antibody kit test kits. So I think this should work, and the efficacy should be fine as long as it's a PCR based test.
I think that would be very important if this works. This would be a good step in the direction, because a lot of people are desisting from these tests because of the cost.
Yeah,
most of
this
these
kit is already being now marketed by a few companies, and these are being already used now, so they are working actually. Yeah,
this is really nice. Arjun, my next question to you. So where does India stand in terms of at-home COVID-19 testing service? Are there any specific rules and regulations for doorstep sample collection, and what are they?
Sure. So this is really important because anyone who is severely ill or has the symptoms of COVID-19 or has been quarantined obviously requires the test to be done at home. Now, to test at home, you would definitely require the three documents as per the government's mandate for the RT-PCR test that I'm sure everyone already knows about. That is the government ID, the doctor's prescription, and also a duly filled ICMR form. Once you have these three, there are various labs that offer the home collection services, and the sample can be taken at home. Also, what has happened over the past few months is that there has been a lot of innovation in this field. about actually collecting samples. And we came up with the drive-through testing or the drive-in testing, and we have few centers in Delhi NCR that provide a drive-through testing. What the drive-through testing actually provides is a very safe way of giving your RT-PCR nasal and throat swab by the comfort of sitting inside your car. Although we do understand that the luxury of owning a car and a drive-through is only with a small segment of the population in Delhi, and that's why we've also started including two-wheelers, bikes, and motorbikes. But the feedback that we've been getting from the patients is that this is a wonderful technique where the entire sampling takes just about 4 to 6 minutes. And the most important things about this is that it is the most safe procedure because there is minimum exposure both for the patient and for the medical staff, and there is minimum interaction as well. So the drive-through testing has been a huge success that has supplemented the home collection for COVID-19 tests.
So, Arjun, where all is this drive-through testing happening? Is it only in Delhi or other cities also?
So in Delhi NCR, we have 3 centers. One is in West Delhi, one is in Saket, and the third one is near Asia Games Village, that is near City Fort. And apart from Delhi, there are multiple other cities as well, such as Mumbai, and even Gurugram has one. So there are a few other cities that have also implemented the drive-in testing.
So this is really encouraging for people who are scared to go to the hospital for testing. And with this, I come to Mr. Rakesh. Rakesh, can we also expect any easy to do home testing kits for COVID-19 in the near future?
Not in the future. We already have, antibody and antigen kits in the market now. But, coronavirus is such a, disease where it's an exception, actually. We have never encountered this kind of a pandemic, in last 100 years. Here, contact tracing and identifying each and every patient is very, very critical. If a person does testing at home and he doesn't tell the authorities, that is the place where, the chain breaks, and that person, if he's, reluctant to tell anybody, and if he goes out for any work or anything, and I mean, he can spread the infection to a large number of people. So that's why the government is not doing it right now. But the situation as such, you are seeing that the cases are increasing, and we know that 80% to 85% of the cases are asymptomatic. So at the end of the day, every individual would like to have the power in their hand to have some kits at home. If they see that somebody is sneezing outside and they came in contact with that person, I mean, this is now becoming a kind of a psychological, issue that I should be tested, and I cannot go every time and do real-time PCR. If I have something at my home and I can do a test and to identify whether I am positive or not, I mean, this will be required in the near future. But the second thing is that it can be only done when people become, responsible enough that they test. If they come positive, they should inform the authorities.
Okay. Also, we were just talking about the antigen tests. So a lot of these rapid antigen tests come with a high risk of false results. If you could shed some light on this.
Yeah. So initially, I mean, the antigen. So the question is to me.
Yes.
Yes. So the initial antigen kits which were imported from China, there were batch issues in that, and a lot of newspaper articles were there that they are not sensitive enough. Yes, antibody tests, they are not specific enough because antibodies develop only after an early infection, 4 to 5 days IgG IgM develop, and then only you can test through an antibody kit. Antigen kits, yes, it directly detects the antigen particle, so they can be good, but they need to be thoroughly tested on a large section of people, like the vaccine is being tested, to understand the efficacy. It should be more than 95%. But we are seeing that whatever kits which are there in the market, they give a lot of false positive results, because antibodies can also develop in people with normal flu and other conditions. So detecting an antibody is certainly no. It's just to detect whether a person has contracted corona and he has recovered or not. Antigen testing is something. There is a recent indigenous kit has been launched by my lab again, who was the first to launch the real-time PCR kit. This kit has been approved by ICMR called PathoCatch, and I'm very hopeful that this kit becomes something where for each and every person who has symptoms, if they test positive, then they have to isolate them. With this kit, if somebody tests negative, then they should be validated using a real-time PCR. So with negative people, we should not take any chance. We should cross-check whether, because positive are already, you have identified. For negative also, you should validate on a gold standard real-time PCR test.
Okay, sure. That would be like helpful to do that. So I'll come to Dr. Dang with my next question. Dr. Dang, what is pool testing all about? How does it work, and how does this method help? And is it feasible to do pool testing in India?
Sure. So pool testing is something that is very interesting. Even the ICMR had certain guidelines and a circular was released for pool testing. So pool testing essentially means that you pool samples from multiple people and then you test them. So for example, if you have 100 people, instead of doing 100 tests, if you take batches of 5, so you pool them into 20 samples, and then you run these 20 samples. If any one of these comes positive, then you test the 5 people who were in that particular pool again to specify which one is COVID-19 positive. Now, pool testing is a very good technique, but it should be done in a very discerning way. So only in containment areas, in hotspots, in certain populations where there is a very high prevalence or a very high disease burden, should a pool testing be done. It cannot be done on an everyday basis for everyone, but yes, in certain conditions, like I mentioned, it is a very useful tool.
Thank you, Arjun, for this. So is it happening in India right now, or is it going to happen in the near future?
So the government is doing pool testing in certain areas, but none of the private labs, as far as I know, are doing pool testing as of now.
Okay. Also, my next question is again to you, Arjun. So there are reports of fake COVID-19 tests being offered by various diagnostic labs. How widespread is this practice in India? And what measures do you think should be taken to curb this?
Okay. So Pooja, definitely I'll agree with you. Even I have heard of such reports. But again, I would beg to differ that as far as I am aware, the majority of the private labs are stretching their limits and working tirelessly to actually do good, genuine work to add value to a patient and add value to the health of the country in this pandemic that we are sitting in. And as far as fake reports, etc., go, the ICMR and the government definitely needs to do audits that they already do. NABL accreditation should be mandatory for every lab that is performing the RT PCR test. And as far as I know, what you're mentioning might be a one-odd case, but as far as I am aware, this is not that prevalent at all.
Okay, so we shouldn't be worried. Yeah, so you're saying it's okay, it's not prevalent, but some of the labs are doing it, and they need to be.
I'm saying that I'm not sure and I'm not aware of many labs doing it, but the government definitely also has certain regulations in place where every lab that is authorized by ICMR needs to send their samples for cross-checking with another nodal institute. So there are a lot of audits, a lot of regulations, a lot of checks in place. And I don't think there would be many such labs that you are referring to.
Okay, sure. I understand there are strict guidelines for the labs also. And you guys are also like the frontline warriors managing this pandemic for us. So that goes without saying, of course. Also, Mr. Maurya, let me come to you now. So recently, the National Center for Disease Control conducted a serological survey in Delhi. Yeah. Our audience would like to understand what a serological survey is and how is it done? And are the reports that come out of the survey accurate?
Okay, so very good question. Sero survey, I mean, it's not new. It's very it's a technology. It's a tool to identify the antibodies against an infection in a population. So I'll give you a background. Generally, sero surveys were done in India or previously for immunization programs like for polio, it's recommended that the sero survey in a population should be more than 90%. Mean antibody should be present against polio in 90% of the individual, more than 90% of the individuals, to identify whether the immunization program is going well or not. If it's less, then you have to keep doing the immunization program again and again. Now, this method is also very, very useful to identify asymptomatic cases, to identify sporadic cases where you cannot contact trace, or the cases where you cannot identify the source of infection. So what happens is that you take districts or sub-districts or regions or populations where you are finding large number of individuals positive with coronavirus, but you are not able to contact, trace, or identify the source of infection. So you cannot delineate a boundary between normal general population and a hotspot region, and also you cannot to identify how many people have actually contracted the disease. So you do a sero survey, you do antibody tests for a particular region that has been predefined. You take random sampling, create a small subset, and do random sampling of the population, and then you check what's the prevalence of antibodies in those particular individuals. That can tell you three things. First, as I told you, the percentage of the population who has contracted the infection, and they might have recovered, or something. So the person, so like in Delhi, you have recently identified around 23% of the population has contracted the virus, or they have been exposed to this. This includes both symptomatic and asymptomatic individuals. So a lot of asymptomatic people also were tested here, because this is random sampling. You don't look at the symptoms. You just take samples randomly from people. The second thing it does is that people where you cannot identify the source of infection, at least now you can mark from the district where exactly you have collected the samples and where the patients who were positive are coming from, and create a boundary around that region to create a new hotspot or create new markers or delineate those areas. This is very important since the infection numbers are rising rapidly. Sero survey should be done overlappingly every week and in overlapping regions and boundaries of a city or of a state. And this is the only way by which you can identify the source of infection or the boundaries where the infection is prevailing without anybody knowing. And asymptomatic, as you know, that almost 80% to 85% people are asymptomatic. So it's really challenging to identify those people. So sero survey is something which can give you some data points to identify this. So on a smaller population, you generate some data and then you extrapolate it to the population.
So then the results are usually accurate?
Yes. So the mathematical models which are used, they are proven. I mean, see, it's again like a herd immunity. These are mathematical and theoretical algorithms, but they are fairly accurate in judging and identifying what's the prevalence and where the infection is going in terms of tracing or how it is moving in a particular direction in a particular state or country.
Thanks, Mr. Maurya. That makes it quite clear about the sero survey. Also, Dr. Dang, my next question to you. We would like to know a bit about the ICMR approved COVID coverage ELISA test. How accurate is this antibody test in your findings?
Sure. So, like what Maurya ji was saying, the antibody test is not a diagnostic test. It is exclusively for surveillance. So that is very important for the population of India and also the physicians to understand and implement. And the gold standard for diagnosis remains to be RT PCR. But the ELISA or the antibody test, as Maurya ji has already explained, is only indicating people who've had the infection and have now recovered and produce the antibodies for it. The COVID coverage ELISA kit is an ICMR manufactured kit that is now being manufactured by Zydus as well. That's what I believe. And it has shown very, very good results. And also it is being used extensively for the sero surveillance to know what is the disease burden in the population, what is the herd immunity that has developed, and will also be used in the future but again with a lot of caution, and also to understand that this is not a diagnostic test and only tells us about surveillance or about past exposure of the virus.
Right. So thank you for this. Also with this, I would like to get to the audience questions. We've got some questions from the audience. So I think the first question is for Dr. Arjun Dang. So Dr. Arjun, do we have enough COVID-19 testing laboratories in India? What is the gap between demand and supply?
Sure. So this is again a very important question, but again, we must keep in mind when we were way back a few months back when the COVID-19 pandemic had struck India and then rapidly increased and still has been seen to be increasing rapidly in a lot of states. Initially, we had close to about 100 labs, and these labs were ramped up over a matter of few weeks, and these are many more than 1,200, even close to 1,500 now when you put in together all the government and the private setups. Also here, I would like to make a mention of the widespread antigen testing that is being done. And again, as Maurya ji also pointed out, the false negatives are very high in an antigen test, but any positive that you get in an antigen test is a true positive. So a positive patient, a patient who tests positive on the antigen test is obviously reducing the burden on the PCR labs. And along with this antigen testing and the PCR testing, the combination has definitely led to an increase in accessibility for the common man actually to go out and get a test done. But obviously, is it enough or is it not enough? That only time will tell. But the government, along with the private sector, has really ramped up the testing. And I would say that at least in the tier 1 cities and the metro cities, there are a lot of options for the common man to get tested.
So also when we're getting a lot of these false negatives, isn't this kind of create a false sense of hope and confidence, and the people start going out and stuff?
Yes.
So how do you deal with if you get a false negative once or twice?
So
How
Pooja,
does one?
on the antigen test, even the circular that was released by ICMR regarding the guidelines, it says abundantly clearly that any negative on the antigen test who is a clinical suspect or has the symptoms or has had direct exposure and there is a high probability that they are a COVID-19 suspect has to be repeated on a real-time PCR based test. That's why the interpretation of these antigen tests should not be done by the patient. They should be left to the physician and the team of doctors guiding them. Because like what Maurya ji was saying, the home testing also, that is a very high false negative. And if the general population starts interpreting it, then the situation can actually become worse than what it is right now.
Yeah.
Okay, that makes it quite clear. So hopefully, people kind of understand the difference between the antigen test and the ICMR test. So thanks, Arjun and Mr. Maurya, for shedding light on this very important topic for us. Thank you for your time and being with us. Thanks a lot.
Thanks a lot
Thank you, Pooja.
for inviting us.
Thank you.
Thank you.